بسم الله الرحمن الرحيم. Assalamu alaikum wa rahmatullahi wa barakatuh. Inshallah, today we will talk about the colon cancer, also known as bowel cancer and colorectal cancer. So, what is colon cancer? Colon cancer is cancer of the colon, which is the final part of your digestive tract. Most cases of colon cancer begin as small non-cancerous clumps of cells called adenomatous polyps. Over time, some of these polyps can become colon cancers. So colon cancer or colorectal cancers begins when healthy cells in the lining of the colon or rectum change and grow out of control, forming a mass called a tumor. The epidemiology of colon cancer. Globally, colon cancer is the third most commonly diagnosed cancer in males and the second in females, with 1.65 million new cases and almost 835,000 deaths in 2015. Rates are substantially higher in males than in females. The highest incidence rates are in Australia and New Zealand, Europe, and North America, and the lowest rates are found in Africa and South Central Asia. It affects about 1 in 20 people in the US. The second leading cause of cancer-related deaths, third most common cancer in the US. Most people diagnosed with colon cancer are over 50. So, what is the risk factor of colon cancer? Being older than 50 years of age, use of alcohol and tobacco, lack of physical exercise, low fiber diet, personal history of inflammatory intestinal conditions, family history of colon cancer. Colon cancer are classified as 1. Well differentiated, 2. Moderately well differentiated, 3. Poorly differentiated. About 20% of cancer are poorly differentiated. They have poor prognosis. About 15 of colon cancer are classified as mucinous or colloid because of prominent intracellular accumulation of mucin. Invasive colon cancer is most commonly staged from A through D, or from 0 to 3, according to the Duke's classification. Stage A, penetrating beyond the chronic muscularis mucosa into the submucosa. Stage B is differentiated to B1 and B2. Stage B1 extend beyond the submucosa into the muscularis propria. Stage B2 extends through the muscularis propria into the serosa. Stage C has regional lymph node metastasis. Stage D has distant metastasis. The signs and symptoms of colon cancer: constipation, diarrhea, blood in stools, narrow stools, unexplained anemia, tender abdomen or abdominal pain, unexplained weight loss, weakness, and fatigue. So how we can diagnose of colon cancer? We can diagnose of colon cancer by colonoscopy is the preferred diagnostic test for colorectal cancer. Biopsy of lesions is required to establish a diagnosis. Tumor markers such as carcinoembryonic antigen or carbohydrate antigen. Radiologic studies are used to evaluate the extent of local disease and to screen for metastatic disease. These are the staging of the colon cancer. Stage 0, Cancer has not grown beyond the inner layer of the colon or rectum. Stage 1. Cancer has grown through the superficial lining of the colon or rectum, has not spread beyond the colon wall or rectum. Stage 2. Cancer has moved through the wall of the colon or rectum, has not spread to other parts of the body via to bloodstream, and has not infiltrated to lymph nodes. Stage 3. Cancer has moved to lymph nodes, has not spread to other organs or parts of the body. Stage 4. Cancer has spread to other organs and is now difficult to treat. The treatment of colon cancer can be by surgery or chemotherapy or radiation therapy or targeted therapy. These are different staging of treatment of colon cancer. Stage 0 can be treated by polypectomy, can be effectively managed by endoscopic removal alone as long as the restriction margins are free of cancer. Stage 1 can be treated by surgery, colectomy. Stage 2 and 3 can be treated by chemotherapy or radiation or combination between them. Stage 4 can be treated by chemotherapy or surgery if it possible, or anti-angiogenic therapy or anti-EGFR therapy or radiation if it possible. Treat as first line or as second line or as third line or combination between them. So, how we can prevent from colon cancer? Actually, there are things you can do that might help lower your risk, such as colorectal cancer screening, decrease body weight, doing physical activity and diet, vitamin B6 and vitamin B9 and vitamin D, calcium, magnesium, hormone replacement therapy for women such as estrogen and progesterone, aspirin. So how can aspirin prevent from colon cancer? Adults from 50 to 69 years of age should take daily low-dose aspirin for at least 10 years to reduce their risk for colorectal cancer, according to a set of draft USPSTF. Overall, aspirin appears to reduce the risk of colorectal cancer by 26% to 40%, with at least 5 to 10 years of use required to achieve the reduction. The USPSTF recommends that adults from 50 to 59 years of age take low-dose aspirin for the primary prevention of colorectal cancer. Adults younger than 50 years and those older than 70 years, the USPSTF concluded that there is insufficient evidence to balance the potential risk and benefits of aspirin use in colorectal cancer prevention. Thank you for listening. I hope you enjoyed our presentation with regards Group 9.